This education video will provide an overview of our Worklist Manager or eMAR navigation and documentation for the administration of medications. To access the eMAR and to change a filter, the first thing you will need to do is locate your patient on your patient list, click on them or highlight them, and click on the Worklist Manager icon in your main toolbar. You will note a drop-down menu on the left-hand side. Emergency room RNs will use the ED worklist. GI RNs will use the GI medications. All other inpatient nursing areas will use the medication administration routine scheduled option. This will provide you the current list of all your medications. Ensure you are on the medication administration routine scheduled option to document your medications. You can change the from date or to date by simply manually typing in the times and using the calendar for the date. You can also change the time frame. So 1 hour is the default. You can change to task actual, which is the actual time an event occurred. You will need to choose update for any changes made. Task description and time cells. The task description will display the medication order and administration information. Time cells will display when a medication is scheduled to be given. If you hover over the task description, you will have a conversation box that allows you to see the full task description. And the time cells will populate based on the schedule for the medication. So if it's timed, if it's continuous, if it's PRN, and so forth. And we will discuss that a little bit later. We will now go over the colors of the task descriptions. A yellow time cell and task description indicates it is a scheduled task. A blue task description indicates a task schedule must be manually created. A green trough indicates variable tasks such as one-time medications. A magenta trough indicates a PRN task. This turquoise color or cyan bar indicates a continuous task, so these are your IVs or continuous drips. A red task description and time cell indicates an overdue task. How to mark a task as done, or the administration of a medication. Once you've highlighted your patient and clicked on the Worklist Manager, you will locate the medication. For this example, we are going to use a scheduled task. I will right-click on the time cell in which I want to administer this medication and choose Mark as Done. I will have an override reason that populates. This is because our general administration is done through KBMA, which is our barcode scanning system. If you administer any medication outside of the KBMA application, you will need to choose a description as to why you're giving it through your eMAR. For this example, I chose emergency situation, which is an acceptable response. I check the date and time. If I'm charting past the time or at the current time, I can simply change the time I need to. You will see there is a mandatory field by the icon. Since this is an IV medication, I need to fill in the site. I can choose the access type if needed. And the bottom of the screen, I'm going to click OK. You will see now in my task description box, there is a check mark with my initials, which indicates that the medication has been given. I also am going to use this non-KBMA task category, which would be our saline locks. This one is not going to give you an alert because it is okay to give these medications outside of KBMA. Right-clicking, choosing Mark as Done, and completing the task is going to show the check mark and my initials. How to mark a task as not done or not given. You do not need to access KBMA to document a medication that is not given. Simply find the task or medication, choose the time, If it's scheduled, right-click, choose Mark as Not Done, and you'll be asked to provide a reason. You may choose from the drop-down menu, or you may free text this reason, and you may also add some comments if necessary. Once you click OK, your documentation will reflect a red X with your initials. How to mark a task as done by other. After choosing your patient, clicking on your Worklist Manager icon, I will locate the time frame, right-click on the time cell, and choose Mark as done by other. I will then be prompted for my override reason, choose the appropriate reason, and I'll be taken to my task description box. Mark as done by other is documenting for another staff member who did not, in fact, document this way. This is not an option in KBMA, so the example provided here would be that an IV bag was hung prior to the end of the shift. The prior RN did not document their medication. You came on, verified that the medication was in fact given or administered by the prior nurse, and you could go ahead and assign this task to this nurse. You will then see a check mark and a pen signifying that they need to sign off. Documentation of a continuous task. For this example, we use our continuous IV. You're going to locate the time frame in which you hang a new bag. Mark as done by other by right-clicking. Again, the override reason if you're administering this outside of KBMA, and choose the appropriate reason. Continuous tasks or IVs are only documented once a physical bag is being hung. It is not your hourly rate. We do not touch the administration from, but the administered to is the time if you need to change the time frame for the documentation or administration. Fill in all the mandatory fields, if you've changed the tubing, and so forth. You'll click OK. A check mark will display with your initials, and your task description or your time fields will still continuously be the cyan color to show that it is a continuous med. How to edit documentation on a task form. You will start by right-clicking on the desired time you wish to edit. To document the completion of the administration of an IV piggyback or a continuous fluid, you must edit the previously documented task form. You will right-click, choose the option of Edit, choose Document Form, and you'll be taken back to the task description box. On the right-hand side, there is an IV stop time and IV stop date. This is necessary to fill out once an IV bag is completed or an IV piggyback is completed, but it is specific to the unit in which you work. You will notice now that there is a check mark with a little memo pad and your initials are still there. How to enter a co-signature. You will choose the options of Mark as Done on your medication. However, when you get to the task description box, new information will need to be entered, which is mandatory. However, not all medications requiring a co-signature will show a mandatory field in the co-signature line. Once you've entered all the information that you need to, you will click on the icon on the far right of the co-signature box. Here you will choose the clinician who you're requesting a co-signature from. You will click in the other box, type in their name, and choose appropriately. Once you click OK, their name will drop into the co-signature line, and you'll click OK at the bottom of your screen. You will now see that in the medication that we are administering, there's a check mark with a pen that's requesting a co-signer. How to create a schedule for a manual task. These are your blue medications. You will right-click on the actual task description. You will choose the Create Schedule from the menu. You'll be taken to this screen. Here you will define how you want the medication to be scheduled. It could be glyburide that's dependent on meals, and so forth. You will choose the date, time that you want it to start, how often, and then on the bottom left-hand side you actually need to place in the scheduled times. So if we were choosing our glyburide based on our meals, I would enter the times of our meal trays. Once I define each time, I will click the Add button to add it to the list so that you can see it start to populate on the left-hand side. Once I've added all my appropriate scheduled times, also equaling creating those time cells from our yellow tasks, I'll click OK, and it will go ahead and schedule these tasks out. These tasks will now populate under your scheduled tasks title bar. How to reschedule a task, this instance, meaning just one dose. You will choose the medication that you would like to reschedule based on the patient. Right-click on the actual scheduled time frame. Choose Reschedule and choose the option This Instance. Here you will be taken to a field that asks you to move to a later or an earlier time by hours and minutes. And then it's going to request a reason from the drop-down menu. You may free text or choose from this option. Once you choose your reason and click OK, you will see that your time cell reflects the time that you have changed it. For here, we moved it later by an hour and 30 minutes. And you will see how our yellow time cell shifted. How to reschedule a task, all instances. It may be necessary to reschedule an IV piggyback for all administration times. You will right-click on the actual task description. Choose Reschedule and all instances. You'll be required to put a reason in. And then you will need to choose the time frame in which you want to move the administration times. So for here, you can do later or earlier in hours and minutes. Once you click OK, you will see that the time frames shift. How to add a scheduled task. If your patient had refused to take a medication and now you no longer have that scheduled time cell, in order to administer the medication, you need to add a scheduled task. You will right-click on the time cell in which you want to provide this medication, choose Add Scheduled Task, and choose the appropriate date and time. Once you click OK, your yellow time cell will repopulate and allow you to administer the medication and document. How to change a task from marked as done to not done. In the event that you documented on the wrong patient, you will want to reset this task. So you will want to choose it as not done. You'll find the time cell in which you documented, right-click, choose Edit, and choose Change to Not Done. Put the reason in, and add comments if necessary. This generally does not happen anymore as our preferred administration is KBMA. However, there are some units that still use this eMAR. How to reset the task status. In the same scenario as just spoken about, you could also reset the task status. If it was a not done and the patient now wants to take the medication instead of adding a scheduled task, you could reset the task status, choosing Edit, Reset Task Status, which is the right-click function, choose the appropriate reason, enter any comments if necessary, and once you hit refresh, your yellow time cell will reappear. How to view a task schedule. You can view the schedule of your medications by right-clicking on the task description. For this example, using clindamycin, choose the View option and then the Task Schedule option. And here a box will populate that tells you that this medication is due every 8 hours, and in parentheses is the scheduled times. This was a very brief overview of our eMAR. Practice and further training will be covered in your EMD class. Thank you.